The role of medical marijuana prescribing doctors. Medical marijuana prescribing doctors are typically licensed physicians, either general practitioners or specialists, who have undergone additional training or certification to recommend cannabis as a therapeutic option. Their role involves evaluating whether a patient qualifies for medical marijuana under state or country-specific laws and regulations. They assess the patient's medical history, current symptoms, and previous treatment responses to determine whether cannabis could be an appropriate part of the patient's treatment plan. Medical marijuana is often recommended for patients suffering from conditions like chronic pain, cancer, glaucoma, epilepsy, and PTSD, among others. Depending on local regulations, doctors may need to adhere to strict guidelines about which conditions are eligible for marijuana prescriptions and the forms in which cannabis can be consumed, e.g., edibles, oils, vaporized, or smoked. In the U.S., where medical marijuana is regulated at the state level, doctors must also stay updated on evolving legislation and the specifics of cannabis laws in their jurisdictions. For example, a patient living in one state might be eligible for medical marijuana, while a patient with the same condition in another state may not be. The evaluation process. When a patient approaches a medical marijuana prescribing doctor, the first step involves a thorough medical evaluation. Physicians consider a variety of factors before making a recommendation. They look at the patient's current diagnosis, prior treatments, medication history, and how the patient's condition affects their quality of life. Some doctors might require evidence that the patient has tried other forms of treatment before suggesting cannabis as a final option. In many cases, a formal diagnosis from another healthcare provider is necessary, especially when dealing with complex conditions like cancer or epilepsy. After establishing that the patient qualifies under state guidelines, the doctor will prescribe a particular dosage or form of medical marijuana. This process requires balancing the potential benefits of cannabis against its risks, which can include addiction, cognitive impairment, and interactions with other medications. Challenges faced by medical marijuana prescribing doctors. Despite the growing acceptance of medical marijuana, prescribing doctors face numerous challenges. One of the main hurdles is the lack of comprehensive clinical research on the long-term effects of cannabis, mainly due to its classification as a Schedule I drug under federal law in the U.S. This designation places cannabis in the same category as drugs like heroin and LSD, making it difficult to conduct large-scale clinical trials. Without robust, high-quality evidence, many doctors feel uncertain about recommending marijuana, particularly for conditions where traditional treatments are better studied and understood. Another major challenge lies in navigating the evolving legal landscape. While medical marijuana is legal in many U.S. states and several countries, it remains illegal at the federal level. This legal gray area puts physicians in a difficult position. Some may hesitate to prescribe medical marijuana out of fear of legal repercussions, especially if they work in federally funded institutions like VA hospitals. Additionally, medical boards in some states require physicians to take specific courses or certifications before they can legally recommend cannabis, further complicating the process. Patient misconceptions about medical marijuana also present challenges. Many patients assume that because marijuana is a natural remedy, it is free of risks or side effects. However, cannabis can cause a range of side effects, including dizziness, dry mouth, altered judgment, and in some cases, exacerbation of psychiatric conditions like anxiety or depression. It is up to prescribing doctors to educate patients about these risks and set realistic expectations regarding the efficacy of cannabis. Benefits and impacts of medical marijuana prescribing doctors. The work of medical marijuana prescribing doctors has had profound impacts on patient care, especially for individuals who have not found relief with conventional therapies. For patients with chronic pain, for example, cannabis can provide an alternative to opioids, helping to reduce opioid dependency and the associated risk of overdose. A 2019 study published in JAMA Internal Medicine found that states with medical marijuana programs saw a reduction in opioid overdose rates, highlighting the potential public health benefits of medical cannabis. Furthermore, patients with conditions like multiple sclerosis, epilepsy, and cancer-related nausea have reported significant improvements improvements in their symptoms after using medical marijuana. Cannabinoids, the active compounds in cannabis, interact with the body's endocannabinoid system to help regulate pain, mood, appetite, and inflammation. For many patients, these effects lead to an improved quality of life, especially in cases where traditional medications have failed or caused debilitating side effects. The ability of medical marijuana prescribing doctors to offer an alternative, personalized treatment also enhances patient autonomy. By giving patients more options, physicians can help empower individuals to take control of their healthcare and choose a treatment plan that aligns with their preferences and needs. Ethical considerations. While the therapeutic potential of medical marijuana is widely recognized, it also raises ethical concerns. Doctors must weigh the benefits of cannabis against its potential for abuse. Some critics argue that prescribing marijuana could inadvertently lead to recreational use or contribute to the normalization of cannabis in populations not medically in need. Medical marijuana prescribing doctors must navigate these ethical dilemmas carefully, ensuring they maintain the highest standards of patient care while advocating for safe and controlled cannabis use. Conclusion. Medical marijuana prescribing doctors play a crucial role in bridging the gap between patients in need of alternative therapies and the strict regulatory frameworks governing cannabis use. Despite the challenges of limited research, complex legal structures, and ethical concerns, these doctors have a profound impact on patients' lives. As the field of medical marijuana continues to grow, the role of prescribing doctors will remain pivotal in shaping how this treatment is used safely and effectively in modern healthcare. The future of medical marijuana may well depend on the efforts of these pioneering physicians who continue to advocate for its place in clinical practice while ensuring the safety and well-being of their patients. In the UK, medical cannabis is legal and can be prescribed for specific conditions, although its use is tightly regulated. The following illnesses or conditions may qualify for a medical marijuana prescription. 1. Chronic pain. For patients with severe, treatment-resistant chronic pain conditions, medical cannabis may be prescribed as a last resort option. 2. Epilepsy. Certain types of severe, drug-resistant epilepsy, such as Dravet syndrome and Lennox-Gastaut syndrome, may qualify for medical cannabis, particularly CBD-based treatments. 3. Multiple sclerosis, MS. Medical cannabis, specifically a drug called Sativex, a cannabis-based oral spray, can be prescribed to alleviate muscle stiffness and spasms in MS patients when other treatments are ineffective. 4. Nausea and vomiting from chemotherapy. For cancer patients undergoing chemotherapy, medical cannabis may be considered to manage nausea and vomiting that doesn't respond to conventional antiemetics. Although other conditions might theoretically benefit from cannabis-based treatments, prescriptions are currently limited to these cases where conventional therapies have proven ineffective. The approval process remains stringent, requiring specialist consultation and careful consideration of the risks and benefits. Cannabis prescriptions are not issued through general practitioners, GPs, but only through specialist doctors.